Hi, it's Jenny D, and we're checking in with Dr. Kohli. Of course, know her, see her all the time as the 9 News medical expert. And also Cherry Creek Heart in Aurora. That's her practice, preventative and general. And there's so many things that we get to learn from you, and I appreciate that to make us healthier and really worry about our wellness a little bit more. One of the things that I keep hearing about, and as a mom especially, it's freaking me out, is norovirus. So why don't we start with... it seems to be everywhere, but what really is it?
Yeah, it's a virus that causes a stomach bug, a gastrointestinal illness. And if you've ever had it or known anyone that has it, it's incredibly unpleasant. You're talking sudden onset vomiting, severe diarrhea, abdominal pain, cramps. You can get fevers. And the thing about this virus is it's really, really hardy. So you just need a few tiny little droplets of virus, whether it's from a surface, whether it's from somebody who goes to the bathroom, forgets to wash their hands, and then prepares your food. And it can take off. So if you have somebody in your home who has norovirus or one of the kids brings it in from school or daycare, the likelihood that other members will get infected is really quite high.
Well, and it happened at where my grandmother lives, like in her home. And it was, I mean, especially for elderly, it can be very, very dangerous, even deadly sometimes.
Yeah.
And why do you think the cases are going up so much?
Yeah, so this is a bit of a head scratcher for us in the medical community. So there's us factors and then there's virus factors. And in terms of the us factors, I think that our hand hygiene habits have sort of petered off. You know, we're not quite
we were
as
good
careful.
at one point. Now we're like,
Yeah. And then the tricky thing about this virus is that hand sanitizer doesn't kill it. So oftentimes when I'm sitting on a plane or something like that, I'm just popping hand sanitizer in my hands. But you really need that soap and water for 20 seconds to get rid of that virus because hand sanitizer doesn't deactivate the virus. It's got a coat on it that sort of protects it. So that makes it easier for it to spread. It survives on surfaces really long. But we're also thinking this year there may be a new strain that's a little bit more aggressive. So it's sort of evolved over the last few years to now become more easily transmissible, last longer. And I think that those are the factors contributing.
So if you are on a plane and things like that, like a Clorox wipe, things like that, good for it? Will those kill it? Okay.
Yeah, so you can't use those on your hands because you don't want to use bleach on your hands. But certainly on surfaces, a Clorox wipe or a hydrogen peroxide wipe, like on your phone, you might not want to put, for example, a bleach-containing product. But if you get a hydrogen peroxide wipe, that's a nice way. And I definitely have been sanitizing my phone regularly. And same thing when you leave the restroom on the plane, you close the door with a handle. When you come back to your seat, you want to make sure that you put the hydrogen peroxide wipe or something on your hands so that you can really try to inactivate that virus, and try to use utensils to eat and try not to touch your face as much.
Right. And the touching my face, that's something I'm like, I notice it's a nervous habit that I do. Yeah. And whenever I'm thinking about it, I'm like, oh no, okay, stop. Because I itch, like we just randomly itch our face or do whatever.
Well, it's funny. It's that some data tells us hundreds of times a day we touch our face. Yeah. You know, whether it's to adjust our hair or whether to scratch something or just, fiddle with our eyes or our mouth. Or
I'm trying to not do it right now.
Yeah.
I'm like, I'm going to sit on my hands, actually, because now I feel like I want to do it. And I would be the one that would get it. So is there a test for the norovirus?
Yeah, so if you get it, you don't need a test. I mean, doctors can test for it and they look at your stool, but you don't really need to test. You can kind of assume you have it. It comes on about 12 to 48 hours after your exposure. So if you go out to a restaurant, eat something, you can ask other people if they got sick. Most healthy people, Jenny, in a couple of days, they'll be fine. But they do have to isolate and use a separate bathroom because if you're using the same restroom as other family members, you're likely to get them sick. You can't prepare anyone else's food while you have norovirus for at least 3 days after your symptoms sort of resolve. And here's a big one. Don't take Imodium because many of us are tempted when we have that diarrhea to run to the Walgreens or something and pick up some Imodium. That can actually make it last longer. So you don't need antibiotics. You don't need Imodium.
You just got to let it run its course.
You do. And the only thing you have to make sure is you're staying hydrated. So if you're not even able to keep water or liquids down, that's when it's time to go to the doctor or the emergency room.
Okay. That makes sense because you're basically just taking all of that right out of your body.
Well, you're losing so much that you really have to replete it. And the people that are high risk, you mentioned, your grandmother, the elderly, certainly to get dehydrated, but also young kids as well. They can quickly fall behind. And the thing about these high risk groups is that because their immune system's not as robust, they shed for a long time. So even after your symptoms go away, you can shed the virus in your stool for about 2 weeks afterwards, especially if you're in one of these high risk groups. So even if you're feeling better, you kind of want to be careful around around your family members, especially the older ones.
Yeah.
Just to make sure you're washing your hands 20 seconds, soap and warm water.
Yeah, you remember
sure.
that? Remember during COVID when we learned how to do that? That was a fun time.
Happy birthday twice.
Right.
Yeah.
I love it. Yeah. And what would you suggest to anyone who thinks that they may have been infected? Besides, of course, trying to isolate yourself, is there anything else that they can do to try to kind of help with comfort?
I would say stay home from work if you're, because you're going to spread it to other people. So even if you're yourself feeling well, try to see if you can work from home or kind of take a few days off. And then just make sure you let anyone else know who you might have been in contact with, shared any utensils with, shared glass of water with, anything like that in the last couple of days that you did come down with this so that they can take those precautions as well.
Yeah. All right. Well, I have 2 small kids, so I never share anything. I'm like, you're not drinking out of mommy's water. I've learned that over the years.
Well, especially in Colorado right now, we're in the midst of a pretty bad outbreak.
Yeah.
So the more precautions we can take, even with our family members, the better.
Well, and it's so dry. Like, I feel like the number of times we wash our hands, like they're chapped so it's a good thing to use the soap instead of the hand sanitizers anyway. But this is something that can help, and just be healthy. Okay. Wash your hands.